We want to train not only the executive, but also the administrators of hospital. This is where we are targeting. How do you manage medicine? How do you manage stocks and stocks out? How do you get the right medicine on time? How do you help the supply chains for pharmacists to send medicines on time and efficiently to those hospitals, all right? Then, we are also going to the level of human approach to treating patients. And finally, we are going also to the area of how do you move from the hospital to the schools to teach basic healthcare. You know, we have established the first MBA in healthcare management across the African continent. We are doing it with Wharton Business School. Lecturers from Wharton Business School, but from all across the globe. There are very many, all right? And the job is to transform leaders in the healthcare sector. The place where we are getting most people from are from the United States. So we're trying to begin to see what we can learn from Obamacare, basically, all right? Those guys are thinking, whereas the rest of the healthcare sectors have sort of stalled with a very huge burden on the insurance sector and a huge burden on the government expenditure. What can we learn from Obamacare? What can we learn from the advancement in healthcare service provision? So that's what I want to bring through the MBA Healthcare Management Program. And then the small programs that I've talked about, that we reach out to the ordinary person managing the hospital. Executive programs for administrators in hospital pulled from the MBA Healthcare Management Program. Are we together?
Yes.
It is you and me who are running the hospitals who also have to be affected, because if the leader knows but has no people in the bottom to do what he wants, then how can you transform the healthcare sector? It's impossible unless we go to the administrators, and that is what I'm saying. Now we are moving from the MBA Healthcare to operational programs and modules for all the workers in the administrators in the healthcare sector, and a forgotten place. That one is never taught in the medical school.
Yeah.
When we finish medical school, we take the doctor and tell him, run the hospital. What management do they know? What marketing, what human resource management, what operations management, what human resource management do they know? They know nothing. And you see, we forgot about that part and thought by being a good doctor, you are a good manager. Wrong. For the executive level, you have to do the MBA. For the operations, we are going for quick solutions. It will be spurts of modules, half a day, half a day, half a day, probably together it will be about 3 months. We are going outreach. We won't move Strathmore away from Nairobi, but we will move the lecturers away from Nairobi to the level 5, level 4, level 3, to the nursing center. Because nursing center is very important for school kids, very, very important, and mothers at the bottom of the pyramid. To start the MBA program, we invested about $500,000. But now, slowly, the participants are paying back that money, right? We invested it up front. So, for instance, in developing a concrete curriculum, okay, to getting the lecturers, all that is where that went to, all right? We employed lecturers from Wharton Business School to come and develop the curriculum with us. All those fairs, all those transports, there are so many things we did. The classroom setting, the partnerships we are going to have, because they must have a global experience when they leave Kenya and go and see what other people in the globe are doing. So all that is included in that.